When I was sure that my hypothesis was proved by experiment on animals, it was necessary for me to try an experimentation on man. Because everybody can tell, oh, it's not the same between animal and the man, and between a fish and a man. so big difference, and it's not possible to tell that your opinion is true. And then it is for that, and in 1926, I performed, I believe it is the first time in the world, the decompressive operation of the labyrinth by opening of the sacus endolemphaticus in a man who has vertigo very severe since many years, with deafness, and all the medical treatment failed. And I had the courage, because I was courageous, to try on man this operation. I opened the sacus endolemphaticus by transmastoid way approach with a very great success. Vertigo disappeared, deafness was improved, and hearing was improved. Then the patient was much better, and I followed the patient during many years. I was completely cured of vertigo. And it is very interesting to know the profession of this patient. He was a worker of telephone. He was working of the field stringing on the telephone wire. He was obliged to go on, and he was after the operation. He could take again this profession. Then I had with this operation the second proof that my hypothesis of high drops in the Meniere's disease was correct. Animals first, man second.
Dr. Shambo, what do you think is the etiology of Meniere's disease?
This has been quite a mystery ever since Meniere first described this disease in 5 articles in the medical press of Paris about 125 years ago. Meniere insisted that these attacks of vertigo, which previously had been thought to be due to the brain, were actually from the inner ear, but he had no idea of the mechanism or the cause. Professor Portman's demonstration of a relationship between the attacks of vertigo, the loss of hearing, and the endolymphatic sac has been very well proved by the experiments of Schucknecht. Schucknecht and Kimura were able in the guinea pig to produce histologically the same changes in the labyrinth as we see in man, in Meniere's disease. And Schucknecht, who was very slow about accepting new ideas, at first would not agree, but now he says, yes, there is a connection. In the operations which we have done using the Portman operation with slight modifications, we were impressed with the abnormal appearance of the sac. In the first place, the blood supply to the wall of the sac appeared to be diminished in many of these cases of Meniere's disease. When we opened the sac, the walls were adherent, abnormally adherent. Then we took biopsies of the sac wall, and the histologic appearance was so different from that of acoustic neuroma operations, where we took biopsies. There was abnormality of the epithelium in the endolymphatic sac. And our conclusion was that Meniere's disease is due to poor function of the endolymphatic sac, inability to absorb endolymph normally.
Then I agree with you, and After my operation, when I was sure that the hydrops was cured by the opening of the sacus endolophaticus, I have many experiments, not only in France, but in America, and Guile of Baltimore shows moving of the endolymphatic liquid going from the inside the inner ear to the sacus endolophaticus. And I think it is very important to have now the microscopic examination you have made. And I am very grateful to you, Mr. Chambaud, a great friend, and your pupil, your co-worker, to have made the sacus endolophaticus and the apparatus endolophaticus on a new plan. It is to say, on the microscopic examination, biopsies, to see the modification of the cells, and particularly of these cells which are so delicate, you understand?
Yes.
At the level of the cochlear canal, at the level of the posterior labyrinth.
Can you tell us what the first reaction was to this new concept of surgery of the inner ear? What was the response when you presented this to your medical colleagues?
Yes, it was very funny. It was in the first session of the collegium, and Barani was present. And after my presentation, Barani told, but it's not necessary to open the sacus endolophaticus. To treat vertigo, I have good result when I separate the dura mater from the posterior wall of the petrous ball. Then I answered to Mr. Barani, but you make my operation, but you don't know. And you make my operation bad, because you make a rupture of the canal when you separate the dura mater from the bone, at the place where the sacus endolophaticus is going in the aqueductus vestibulae, you rupture and you make a decompression of the labyrinth. Then I think it is better to make an operation, a surgical operation, well performed, like an operation. And after, nobody was impressed. And I suppose there was a silence during many years. In spite of that, I was sure that my opinion was exact. And I continue. In all cases in which you make operation with a good selection of cases, I think it is very important. And my selection is when the patient has vertigo, not cured by medical treatment, all kinds of medical treatment. When the patient has a hypoexcitability of the vestibular apparatus, and when the patient has a hypotony of the sympathetic nerve. And when you have these three questions answered, I think you can operate in good conditions. I know Mr. Hoffman makes the glycerol test.
Yes.
All right. I think it is a test more. But perhaps it is more indicated for the deafness, for the hearing,
Yes,
than
it
the
is.
vertigo.
Mm-hmm. Yes.
And now I am very grateful of your school. However, I must tell also that Japan school was very good for me. And the first man who made my operation was Naito. And he gave exactly the same result. He modified a little the technique about the fistula. But he has a very good result, and he published the result. But it is mostly since the last year, not you, and many others American. But you, mostly, Professor Chambaud, my friend, and you, who make again my experiment to see if I was true, because you're not very sure. You believe perhaps what is not absolutely exact. Then you make my experiment to verify. But I accept that very well. In science, we must be examined by the other people. And with a great sincerity, understand? You see that my opinion was correct. And you published that. And you don't put in the background the man who began this treatment. And I am very, very grateful of that, you know. And now you have opened a new way of research with electronic microscope, with the examination of the cells, and to see that is not only the vertigo but also the hearing. And it was logical. My first operation in 1926, the patient was there from one side. And after the operation, the hearing was improved. And it was improved definitively. And he has no vertigo again. But today, we modify our point of view. Because the patient comes to us because he has a vertigo. The vertigo is the most penible, I don't know in English, penible, most frightful sign. When the patient has a great vertigo during 1-2 days with vomiting and so on. So and you go to see the patient for that, not for deafness. And in the evolution of the many disease, after each crisis of vertigo, the patient is a little more deaf. And after 2, 3, 5 years, he's completely deaf, but he has no vertigo. And many people believe that you have a union between the deafness and the vertigo, and it is, and if you arrive to be deaf, it is the best manner to be cured of the vertigo. And I remember at the beginning of my study, some physicians gave quinine to give the patient deaf very quickly and to see the disappearance of the vertigo. I think it's completely stupid. It was because the deafness and the vertigo was a result of the hypertension of the liquid. It is not because the patient becomes deaf that he has the vertigo disappear. It is because he has hypertension, high drops. Then we must treat high drops. And we arrive now in a new part of the evolution of this treatment, of this surgery, is the surgery must be also the surgery of the deafness. It's not only the surgery of the vertigo. And during a great part of my scientific life, in my mind was always vertigo. My publication were surgical treatment of vertigo. No treatment of vertigo of many disease, of deafness of many disease. Surgical treatment of vertigo. And today, we must believe that it is not the vertigo, but also the deafness. And this deafness is produced, like Arenberg showed with a microscope, by the destruction of the cells, the cilia cells. And if we can suppress the cause of the trouble of these cells at the beginning, we can have a recuperation of the hearing. But if you wait, the deafness must be definitive. Then you know we have a difference between the vertigo and the hearing, vertigo and the deafness. We have a surgical treatment for vertigo, a surgical treatment for deafness. And a patient who has a slight deafness must be operated of the opening of the sacus and olaphanicus. It is a new idea. And I have a very good story about that. It was just before the last World War. I have seen a woman with a big Meniere's disease, big vertigo, with vomiting. And the test shows that was the left side. On the left side she was deaf, a great loss of hearing. I operate this patient on this side. On the other side she has a beginning of deafness. The audiometric test shows that was a beginning of deafness. And the day after begin the war. And after we have 5 years, 6 years with occupation after the war, it was not possible to see the patient. And I see this patient 6 years after. I was completely astonished. She was cured of vertigo on the left side. And on this side, she was deaf. She has a great improving of hearing. The hearing was most normal. On the right side, which was not operated, but had a beginning of deafness, she was completely deaf. I believe that this observation is a true experiment to see the necessity to make the surgical treatment of deafness in Meniere's disease at the beginning of the disease, even if the patient has no vertigo and can vertigo. I believe it is a new idea, and we must put that in the mind of the doctors. Because if you wait a long time, the deafness is definitive because you have shown that the cells are completely destroyed.
Yes. You got very good results. Why do you think that for the 40 years or so after your first reports, this was not accepted? Or no one reported about this?
About the hearing?
About the operation in
about
general.
the operation, yes, very good result, but we have a great selection of cases, but in almost all cases, the patient was cured of vertigo and the hearing was good. In all cases was not completely disappeared, but in many cases disappeared, and 50% of cases you have improvement of the hearing.